Hi, my name is Uzma. I'll be doing today wound dressing and I'm starting now. I have my doctor's order. First of all, I will confirm my doctor orders by reading out loud. It says clean, irrigate and pack wound using normal saline every day and PRN. Pack wound using normal saline soak 1.5-inch packing strips. Activity as tolerated and assess vital signs every 8 hours. Before proceeding further, first I will confirm with doctor order my patient name and date of birth, and I confirm both IDs, and after that I can also see doctor order says patient has allergies to Tylenol 3 and the reaction is hives. So I will proceed further and go and collect and gather all my supplies, which I gather now, and I have my all supplies with me. Okay, here is my patient. This is my patient head and this is my patient feet. So I will proceed further. Okay, so after gathering all my supplies, I will do my hand hygiene and I will go and meet the patient. Hi, my name is Uzma. I'm student nurse for today and I'll be doing your wound dressing. Proceeding further, I will confirm my patient ID. Can I see your wristband? Okay, what is your name? Okay, and your date of birth? And confirm my patient IDs. After confirming my patient IDs, I'll be pulling up the curtains and I provide privacy to my patient. And I'm going to converse with my patient and ask more questions. Do you have any kind of allergies? Okay. You have allergies to Tylenol 3? Okay. Yeah, fine. And we are not going to give you Tylenol for today. Okay. What kind of reaction you have to the Tylenol? Okay, hives. And is there any other medication that you remember and you have reaction to that? No other medication? Okay. And if at the scale of 1 to 10, I ask you about your pain, do you have any pain at the moment? No? 0? Okay. And is it okay if I do your wound dressing? Okay. So I took the patient consent and I positioned the patient, and I'm gonna lift the bed according to my waist, and I will do my hand hygiene one more time. And I'm gonna put the clean gloves. Okay. I'm gonna open the wound away from the patient because patient face is here. As I open the wound, I'll be looking for the drainage, type of the drainage, amount of the drainage, and any odor. And after assessing the dressing, I will throw it in the garbage, and I'll be assessing the wound. I'm looking for edema, redness, maceration, or any dry ridges. And I'm palpating a little bit the wound. And I'm assessing by looking at the patient face for any sign of discomfort or pain. And I will remove the gloves. Okay, after that, I'll be doing again my hand hygiene. Now I'm gonna set up my sterilized field to do the dress change. I'm opening my tray and I can see my forceps is here. I will lift my forceps up. I'm gonna take out this band all the way up. Okay, and I will put it close to the patient. Okay. I am taking another cloth all the way up so it's not touching anything, and I'm gonna put it in front of me, and this is my field. And now I'm gonna take out all the other stuff. This is garbage bag close to the patient, gauze, forceps, and some small gauze for dressing. Okay. Now I'm gonna take this water saline. The label is toward my palm. I'm looking at the expiry date and I can see expiry date is here and it's good and it's within the date. I put this water saline in the tray. Proceeding further, I'll be putting out everything and putting on my sterilized field. Okay, now I have already all my stuff, and I'll be okay. Before this, I set up my garbage bin too. I will keep it close to the patient so I can easily throw my stuff. Now I will do my hand hygiene one more time, and I'll put up the gloves, my clean gloves. And this time I'm using this fork. I'm gonna force it. I'm gonna remove this packing from the wound slowly and gradually. Okay, and I'm gonna look onto the length of this packing strip. Now I'm gonna throw it. And after this, I'm gonna look into the wound, the depth of the wound, the size of the wound, and also I'm gonna look for the sign of any bleeding or sign of infection, and any other signs like any edema or any other things. Okay, and after this, I'm gonna remove these gloves. Okay, now I'm gonna put my sterilized gloves. I'm ready to do that. And before starting putting my sterilized glove, I will do my hand hygiene one more time. I have this large size and I already opened it. I'm using the same one. I have the small other sizes which are not good for me, so I'm using, assuming I'm opening it for the first time. Okay. So I'll be holding it from pinching from outside, not inside. Okay. Now I can work on my sterilized feet. I will fill up this syringe with 10 milliliter of water as per doctor order, and I keep it here. And for the strip, I'm gonna cut that according to the size of that patient strip. Okay. And I'm gonna put it in the sterilized, saline water. Okay. Using forceps. This I'm going to use for the irrigation. So let's do irrigation first. So I'll be irrigating, keeping it 1 inch away from the real wound, from the least contaminated to the most contaminated, or from top to bottom, until I be cleaning it, until I get a clear fluid. Okay, and I did it, and I'm gently irrigating the wound, and I clean it. After this, I'm gonna clean the wound. By removing excess water from top to bottom inside the wound. Removing excess water from top to bottom, from inside the wound. Squeezing from outside, from top to bottom. From top to bottom, outside. Now I'm gonna take another gauze make a comfy bed kind of pillow, small, and we'll dry the wound from top to bottom from outside. From outside, from the left side, top to bottom. Now I dry my wound. I have to now fill the wound with this strip. By removing the excess water. Okay. Now I'm gonna pack the wound. Making sure I'm not touching the outside skin. Okay. Now I'm gonna put this dry dressing into the patient wound. Okay. And now I'm gonna put this pad onto patient. I'm going to open it from outside, not touching inside. Okay, and I'm going to tape it. Okay, now I can remove my gloves. And I have to take out everything and make sure that everything is safe and secure. And here I'm going to do some teachings regarding the wound. If today the patient is discharging, I make sure that I tell the patient that please keep the dressing dry and make sure there is no extra drainage, no redness, and no sign of infection. If you see there is a lot of drainage coming out, or if you have a lot of pain, please consult the doctor and book your appointment right away and visit our clinic. Or otherwise, also keep your nutrition high and have a protein-based diet, or as per doctor orders. Also, I be telling my patient that keep his appointment regular and take the medication as prescribed, especially if he has antibiotic for wound, so then take them on the right time as they are prescribed. Thank you so much. And I'm lowering the bed for the patient, making sure bed rails are up, and I will do my hand hygiene. And after this, I'm providing the call bell to the patient and asking if you need anything else, I can be helpful. Before leaving the room, I make sure that I put this dressing date and time. And my initials. And I put this on the same tape. And I cover my patient and I leave the room. Thank you.